As new parents, you have decided to keep your child uncircumcised. This is a decision that you may have arrived at because it is not followed in your religion, or you have studied the data extensively and decided not to do it based on your reading. As soon as you arrive at this decision, you will be bombarded by advice from all sides. You will have people telling you that now that you have decided for no circumcision, you have to gently retract the foreskin and clean under it and keep it very clean. And on the contrary, you will have so many people admonishing you, please do not touch that area and just let it be. As a young parent, for you it becomes quite confusing and frankly scary because you have no experience and you don't really know what to do. Hi, I am Dr. Rajesh Nathani. I am a pediatric surgeon practicing in Mumbai, and I am here today to help you deal with this dilemma. Foreskins have been the topics of debate since times immemorial. So I shall be guiding you through what happens if you decide not to circumcise, what is the natural history of the foreskin, and what care you should take, whether it is of the newborn child, the infant, or as the child grows older, or even into adolescence. I am with you in your journey, and I hope to be able to help you navigate this rocky path. I will be discussing with you how to monitor your child's penile health and when to report to your pediatric surgeon in case you see any red flags or alarming signs. So let us start right at the beginning. First, we understand what is the foreskin. The foreskin is an extension of the penile skin that covers the distal portion of the penis, also called as the glans or the head of the penis. Now, this foreskin is adherent to the glans in almost all babies when they are born. Nature has a plan for the foreskin. You must have noticed that in adults, the foreskin can be retracted back to the junction of the head and the body of the penis. And this did not happen because of intervention. Nature has its own plan. As the baby matures, there is separation of the foreskin from the head of the penis. It gradually separates, shedding those cells, and those cells, along with other secretions, come outside as whitish particles which are called smegma. The statistics are that at birth, 100%, almost 100% of babies are born with tight foreskins. If you do nothing to them, make no attempt at pulling, no attempt at retraction, then 50% of children, the foreskin will be fully retracted. By the time they are 5 years of age, 95% of them will be fully retracted. And by the time they are adolescents, then as many as 99% of them have fully retractable foreskin. So there is no need to retract the foreskin on your own. A combination of nature as well as whenever the child has an erection. And yes, even the newborn can have an erection. The erections are reflex in nature, usually in response to full bladders, and have no sexual connotations. The erection process also hastens the separation of the foreskin from the glands. As always, parents try to help their children, and their well-meaning but misguided attempts can result in a problem for the child. So you do it most gently. You try to pull the foreskin back most gently. Unfortunately for you, the child moves in the opposite direction. And what started off as a very gentle retraction, nothing can be more gentle than that, the touch of a mother or of a father. So if there is forceful retraction, there is stretching and tearing of the foreskin. Now this foreskin tear can be multiple and can be microscopic also, so you may not even realize it. Now, whenever any tissue heals, it always heals by contraction and scar formation. The natural history is scar will form, and over a period of time the scar will shrink both vertically in terms of length of the scar as well as the thickness of the scar. You can imagine that if there are multiple scars in a circular area, and if that contracts, that circle will become tighter. And if it becomes tighter, then it cannot be pulled back. And you have converted what is known as the physiological, which is completely normal phimosis. Phimosis is tight foreskin, into a pathological. A pathological is one where it will not come back. And such children may require circumcision later. So, no attempt should be made at retraction of the foreskin. So now let's talk about smegma. What is smegma? Smegma is that whitish substance that you may sometimes see. Most of the times it is not seen because it is washed away the next time the child takes a shower or you give a bath to the child. So smegma is the shed cells which once they are shed, they flow outwards towards the opening in the foreskin to be washed away in the next shower. Or there are also local oils which are produced, some other substances, but you must understand that infantile smegma is totally different from that of adult smegma. Adult smegma has a lot of sebaceous glands, a lot of hormonal secretions, and looks and smells different. The infantile smegma without any complications tends to be odorless, white, and at the most it may look a little creamy or yellow in color. Sometimes, because the foreskin is stuck at some point, all the smegma cannot escape, and then it tends to back up and form a collection. If it does that, then you may see a visible white or yellow collection under the skin, and which we call as a smegmaolith. By itself, a smegmaolith does not require any treatment unless it undergoes complications like infection. The child has pain locally. So let's go age-wise. So babies and toddlers, treat it like any other body parts. Clean with warm water. You can apply soap to the penis from outside, but do not attempt to go under the foreskin, either with your hands or with cotton buds. There is certainly no need to apply any soap under the foreskin. As the child becomes older, more than 3 or 4, and you notice that the child's foreskin has started retracting, you can teach the child to wash himself. They can gently pull to whatever the limit it is being retracted. Do not try to pull at all anymore because of the reasons outlined earlier. Again, no soap is needed below the foreskin, and emphasize to the child that this is all normal. However, his genital area is private and he should not allow any other person other than his parents or an examining doctor to touch that area. Now, as the child grows older, maybe more than 5 or 6 years of age, and the skin starts retracting all the way back, please instruct your child to always pull it back in the shower, clean under the foreskin with warm water or even a mild soap. There is no need to use any antiseptic soaps, and in fact could be harmful. So please use mild, gentle soaps, and remember to instruct him and show him to reposition the foreskin back. This repositioning is very important because sometimes, and it does happen fairly often as far as we pediatric surgeons are concerned, the foreskin which has been retracted behind is left in that position and sometimes starts getting tighter and tighter, progressively more swollen, which increases the tightness and leading to a lot of pain, lot of swelling, sometimes local infections, and a condition called as paraphimosis. Now, paraphimosis is something which definitely may require surgery or intervention to reduce. Most of the times we manage manually, but while doing the reduction process, there are multiple tears, which again, as I said, heal by fibrosis and scarring and may require circumcision. So, please remember to reposition the foreskin back to its normal position after cleaning the foreskin. So, I have outlined what should be done in normal foreskin development, and this is what happens in the overwhelming majority of children. However, in some children, the retained urine behind the tight foreskin can fester with infection and cause local irritation, local redness, local pain, especially while passing urine. You may notice that the foreskin balloons out. Now, only ballooning out is not an indication for surgery, and it only balloons out because the urine has escaped the opening of the head of the penis, but finds it difficult to go through the tight opening of the foreskin. So it accumulates and causes ballooning of the foreskin. And then eventually, of course, the pressure causes it to open up. But sometimes the retained urine can cause redness and local signs of infection. Some children go on to develop urinary tract infection. That means infection inside, carried to the bladder or even higher. Now this is a different ballgame altogether and may be an indication for surgery. However, you need to get it evaluated by your pediatric surgeon. As far as the smegmas and smegmaoliths are concerned, unless there is local infection, no need to intervene surgically. If you have brought the foreskin back, did not put it back in time, it has started showing signs of swelling, meet your pediatric surgeon early because we may still get away without a circumcision or surgical intervention. So remember, if you have any concerns, it is better to check with your pediatric surgeon. Get your fears allayed rather than worry at home. Circumcision has many religious, cultural and emotional considerations, and because it is such a vast topic, I am going to deal with it in a separate video by itself, where I will discuss what are the indications for circumcision, how to take care of the child after circumcision, and complications if any. I will encourage you to please subscribe to our channel so that you are aware of the next video and are able to have a look at it. If you have liked the video, please remember to hit the like button. Do not forget to subscribe to our channel because we do keep coming with regular updates on different medical and surgical topics for children. Now don't only subscribe, please hit the notification button. That way you get our notification as soon as we come out with a new video. Your comments, likes, even criticisms are most welcome because it helps us improve the content that we send out for you.